So my name is Tannis Hydesmith. This is going to be my med demo. First I'm going to be checking the physician's order to the MAR. So I'm checking the patient name. So Billy Rubin, date of birth February 21st, 1961 on the physician's order, February 21st, 1961 on the MAR. FIN is 1, 2, 3, 4, 5, 6, 7, 8, 9. FIN on the MAR is 1, 2, 3, 4, 5, 6, 7, 8, 9. Both are being prescribed by Dr. Sanders. Both are also going to be prescribed on December 14th, 2021. All of these, so this is my second take, so don't mind this. I will be using blue as a new color. So all of them have not been given, so they're safe to give. I'm going to be giving ibuprofen, warfarin, and Ciprodex at 8 in the morning, just these first doses. So we're going to be going, there are also no known allergies for my patient. So Billy Rubin, and we've talked about this, the physician's orders that we're both giving it on December 14th. So that checks out, and that there are no known allergies. So I need ibuprofen, 600 milligrams oral twice daily. I have ibuprofen 600 milligrams oral twice daily, and it has not been given, so it's safe to give. I need warfarin 2 milligrams oral daily. I have warfarin 2 milligrams oral daily at 8 in the morning. It has not been given, so it's safe to give. I need Ciprodex 1 drop both ears twice daily. I have Ciprodex 1 drop both ears twice daily. It has not been given at 8 a.m., so it's safe to give. So those are my checks. I'm good with my physician's order now. So then I'm going to be washing my hands again. I'm going to be collecting my medications here. So I've got the at-home version. So my warfarin is 1 milligram instead of the 4 milligrams in the lab. So first I'm going to be gathering them. I'll be getting each one, checking the label to the MAR, as well as checking the expiry date, which I don't have on here, but in a real life setting, I would be checking the expiry date. So I've got ibuprofen, 200 milligram per tablet. I need ibuprofen, 600 milligrams oral twice daily at 8 in the morning. So I've got ibuprofen, 200 milligrams per tablet. So I'll be giving three pills of ibuprofen to my patient. So that's ibuprofen. I need warfarin, 2 milligrams oral daily. I have warfarin, 1 milligram per tablet. There is not an expiry date as well. There would usually be an expiry date, but in this setting, there's not. So it's not expired, and neither of my patient is allergic. There are no known allergies, so no allergic reaction there. My last medication is Ciprodex. This also does not have an expiry date, so of course. So I need Ciprodex 1 drop both ears twice daily. I have Ciprodex, which is in liquid form, twice daily, and it's not been given at 8 a.m., so it's safe to give. So next I will be talking about each of the medications, washing my hands again. So we'll start with ibuprofen. These are my med cards. To do this. Okay, last one. So I'll start with ibuprofen. So this is an analgesic, and it's also an antipyretic, so anti-fever. It's also commonly known as Advil, so in many cases this would be an Advil bottle. Also, it's only 20 minutes, so let me know if I'm getting close to time. So its method of action is to inhibit the COX-1 and COX-2 pathways by blocking the arachidinate. It's an anti-inflammatory, again, an antipyretic, and an analgesic. The safe dosing range is 200 to 400 milligrams per adult, for an adult every 4 hours per day. So don't exceed that amount. Don't exceed 400 milligrams every 4 hours. The adverse side effects for a drug like this could be headache, dizziness, or drowsiness, any GI discomfort as well, since it is an antipyretic. So headache, dizziness, drowsiness, those are some adverse effects. Some nursing implications that I will be watching out for is, so I'll be checking once I go and to my patient, I'll be checking the fever, temperature, I'll be checking the blood pressure, as well as any redness or sweating, any pain. So those are my nursing implications and adverse side effects, dosing range, and method of action. So next I'm going to be talking about warfarin. It's an anticoagulant. So the method of action is that it interferes with blood clotting by indirect means. It depresses the hepatic synthesis of vitamin K and is a dependent coagulant factor. The safe dosing range is 2 to 5 milligrams per day to a maximum of 2 to 4 days. That's the max dosing range for an adult. The adverse side effects could be, again, fever, dizziness, or fatigue, or naturally any discomfort that wouldn't work with the patient for the specific dose, for the specific drug. They could get a rash or diarrhea, and so the nursing implications are going to be a blood work set to ensure that they are not having any adverse reaction to this, and I'll be checking. Oh, sorry, we're talking about warfarin. I'm picking up this, but I'm talking about warfarin. I'm gonna go again on the warfarin. So this is warfarin. It's an anticoagulant. Again, it interferes with blood clotting by indirect means. It depresses hepatic synthesis of vitamin K. So it's a blood thinner. So we're gonna watch, especially for bleeds. So the adult dose is 2 to 5 milligrams per day to a maximum of 2 to 4 days. The adverse side effects would be fever, dizziness, and fatigue, as well as it being a risk factor for folks who are prone to bleeding. So those would be my most prominent nursing implications are blood studies. So doing a whole blood panel, and checking for bleeding in the gums, any skin tears for older adults. And yeah, so that's warfarin. And Ciprodex, now we're doing this one now. So it is to treat a bacterial infection in the ear, not a blood thinner. So it's an antibiotic and a corticosteroid. It's going to be dropped in the patient's ear, 1 drop per ear. It stops the growth of bacteria and reduces ear swelling and discomfort, and it only treats bacterial ear infections. The safe dosing range is 4 drops for 7 days, to not exceed that. And adverse effects would be rash, hives, itching, dizziness, any swelling of the face, and some nursing considerations would be avoiding contamination, so ensuring that the patient is not feeling any discomfort, to not push the cotton ball too far into the ear when applying pressure, and don't shake well before using. Some patient education for warfarin would be to avoid any herbals and report any signs of bleeding, as I mentioned before. And any patient education for the ibuprofen tablets would be to use sunscreen or sunglasses to protective clothing to prevent photosensitivity. Avoid driving and any dangerous activities for dizziness for older adults. So those are my drugs. I'm going to be washing my hands again. And then I'm going to be doing the dosing calculation. So for ibuprofen, we have 200 milligrams per tablet. We need 600 milligrams oral twice daily per tablet. So ibuprofen, 200 milligrams per tablet, no known expiry date. We need ibuprofen 600 milligrams oral twice daily at 8 a.m. It's not been given, so it's safe to give. So let's see if I can get this open. Good stuff. So since this is in a 200 milligram tablet, I'm gonna be giving 3, 2, 4, 6. There we go. And immediately after, I'm going to be doing a drug card with bilirubin as my patient. The drug name, ibuprofen. Come show this. So the dose is going to be 600 milligrams, and the volume is going to be in 3 tablets form. It's going to be given at 8 in the morning, and by me, December 14th, 2021. So that is going to go directly on my drug. Oops, I always do that. Oh no. Okay. For speed purposes, I would usually be gathering a new set of drugs. Actually, okay, I don't have enough. So I would not usually do this in a real healthcare setting. I would be getting a new set of drugs, but unfortunately I don't have that opportunity right now, so forgive me. So I'm going to be putting that here. We don't have a nice little table like we do in lab. So that is that. So this is ibuprofen. I'm still going to be doing a second check for that. And then I'm going to be doing warfarin 1 milligram per tablet. We need warfarin 2 milligrams oral daily at 8 in the morning. I have warfarin 1 milligram per tablet with no expiry date on it. So I'm going to be giving two capsules to equate the 2 milligrams needed for my patient. How am I doing for time? 10 minutes? Okay, good. So this is going to be warfarin. I'm making a drug label immediately. Bilirubin. Drug name is warfarin. Dose is going to be 2 milligrams oral. This is also going to be oral. I don't know if I need to put that, but I'm going to put that. So oral, that's the root. 2 milligrams oral. Volume is going to be in 2 tablets. That's not spelled correctly. Tablet. It's going to be given at 8 in the morning on December 14th, 21, and by me. So that's yeah, bilirubin, warfarin, 2 milligrams oral, 8 in the morning, twice daily, or just once a day, at 8 in the morning, and it has not been given, so it's safe to give. I'll be doing another check for that. So here's my drug label. And Ciprodex is the last drug that I'm going to be making a label for. So our patient name is bilirubin. Again, Ciprodex at 8 in the morning, December 14th, 21, by me. And it's going to be given volume 1 drop per ear. The dose is 1 drop per ear, as well as the volume, and it's Ciprodex. So for bilirubin, he needs 1 drop per ear for Ciprodex at 8 in the morning, and it's going to be given by me. We have Ciprodex 1 drop per ear, both ears, twice daily. So this is my drug label for Ciprodex. And then for my second check, I'm just going to be finalizing. All these drugs are the same, so I'm going to be comparing the labels as well as the drug labels together. Make sure I don't go over 20 minutes. So warfarin, we need warfarin. So ibuprofen, sorry. We need ibuprofen 600 milligrams oral twice daily. We have ibuprofen 200 milligrams per tablet, as well as my drug for bilirubin, oral ibuprofen 600 milligrams in 3-tablet form at 8 in the morning to date, December 14th, 2021, as well as me. So this is done. I'm going to be putting that away. We need warfarin, 2 milligrams oral daily. So that's not been given. So I've made a drug label for this. It's for bilirubin, warfarin, 2 milligrams oral in 2-tablet form, 1 milligram per tablet at 8 in the morning. It's not been given, so it's going to be given by me. So that's safe to give, and this is safe to put away. So this is lastly, I have bilirubin. For bilirubin, bilirubin for all of these drugs, obviously. Ciprodex, 1 drop per ear, both ears. It's going to be bilirubin, Ciprodex, 1 drop per ear at 8 in the morning, December 14th, given by me. So that's my second check complete. So I'm putting those away. I'm washing my hands. We're going to be putting the physician's order away. I'm walking into my patient's room right now. I'm going to knock on the door, introduce myself. I'm going to make sure that there's no safety. This is my patient. This is bilirubin. So bilirubin is just here on the bed. I'll put him on my laptop to make a little bed for him. So I'm walking into the room. I've washed my hands. Hi, bilirubin. My name is Tannis Hydesmith. I'm a student nurse here at University of Manitoba. I'm just gonna come in and I'm gonna be giving you your morning medications. So it's about 7:45, let's say. So I'm going to be ensuring that this is my patient. So I'm going to be asking them their name. Could you please state your name and your date of birth for me? And do you have any allergies, any known allergies? No. Next, I'm going to be checking the risk for a known allergy label, as well as bilirubin. Bilirubin, date of birth, February 21st, 1961, FIN 1, 2, 3, 4, 5, 6, 7, 8, 9 by Dr. Sanders. Bilirubin, February 21st, 1961, both match. FIN is 1, 2, 3, 4, 5, 6, 7, 8, 9. FIN is 1, 2, 3, 4, 5, 6, 7, 8, 9. And by Dr. Sanders. So this is our patient for sure. Little gingerbread bilirubin. So I've introduced myself, I've washed my hands, I've ensured that the safety check is done. I'm going to be doing my third check. This is for bilirubin. I need ibuprofen, 600 milligrams oral twice daily at 8 in the morning. I have for bilirubin oral ibuprofen, 600 milligrams in a 3-tablet form at 8 in the morning, and it's not been given, so it's safe to give. I need warfarin, 2 milligrams oral daily at 8 in the morning. I have warfarin for bilirubin, warfarin 2 milligrams oral 2-tablet form at 8 in the morning on December 14th, 2021, today, and it's going to be signed off by me there. So it's not been given, so it's safe to give. And last but not least, I need Ciprodex 1 drop both ears twice daily. I have Ciprodex for bilirubin, 1 drop per ear twice daily, but it's going to be given at 8 in the morning today, right now, on December 14th, 2021 by me. So that's my third check done. Before talking about the patient education to the patient, I'll just be checking that the patient is comfortable and does not have any mouth lesions, ear discomfort, and I'll be doing a blood pressure panel. I'll be making sure that I have a blood panel, a full set of vitals, and asking about a pain assessment. What time am I at?
17.
Okay, good. So now that I've ensured that the patient is who they are, as well as they are safe, and I've done a pain assessment, I've done my set of vitals, and I've done a blood test to ensure that there's no crazy blood situation going on, I'm going to be talking to the patient about each of their drugs. So for ibuprofen, bilirubin, I'm going to be giving this to you for any pain and fever that you might have. So I just want to let you know that it works to reduce your pain, reduce your fever, and it'll make you feel a little bit better. We'll be giving this to you twice today, but this is your first dose at 8 in the morning. This might cause any dizziness, headache, drowsiness. Let me know if you feel any of those side effects. So I'm going to be checking bilirubin's mouth. It's obviously good, so I'm going to be giving them, their medication. So this is ibuprofen. It's been swallowed. They've had the water. I also don't have a proper patient bed, so pretend that they are raised up. Okay. So, sounds good. So I'm going to be initialing off on the ibuprofen. So that's been given. That's away. So the warfarin, I just want to talk to you quickly about that. So that's about your hypertension. So it's going to help your blood thin out to ensure that you don't get any blood clots. So I'll be checking in for fever, dizziness, fatigue, any hypotension, angina. So we're gonna have to avoid any herbals and report any signs of bleeding to me immediately. They've said that that's good, and I will also be doing a full set. I'll talk to you about what I'm gonna be doing after. So this is warfarin, it's gonna be given. That's good. So it's been given, and I'm gonna mark it up, 19. Okay, so this is Ciprodex. I'm gonna be giving it in both ears. This is for, I would be telling them about it first. So this is for ear infection, any bacterial ear infection. I'm going to be giving it. Watch out for rash, hives, itchiness, or dizziness. Please let me know if you have any of those. Okay, is ready, patient's ready. So before I leave, I'm going to be doing a safety check. I'm going to be washing my hands. I'm going to be making sure the patient is comfortable and safe. And I will be doing a lab panel, vitals, and a pain assessment upon my return. So thank you very much, bilirubin, and that is the end of my med demo.